This video looks at your role as a care worker in upholding the CQC Fundamental Standards. There are 13 fundamental standards that we will briefly look at now. First standard involves person-centred care. You must ensure that care or treatment is tailored to the service user and meeting their needs and preferences. You should be doing this every day. It means you work in a person-centred way. You give the individual choices in all aspects of their life. The individual is responsible for leading that care planning process. They are the individual that will give us the information we need to devise that care plan. Doing this, we're making sure that we are meeting that duty of care and we are caring for them in a way that is individual to them. Next, dignity and respect. Service users must be treated with dignity and respect at all times while they're receiving care and treatment. This means making sure they have privacy when they need and want it. It means that everybody is treated as equals. It means they're given any support they need to help them remain independent and as involved as they want to be in their local community. The next standard revolves around consent. The service user or anybody legally acting on their behalf must give their consent for any care or treatment is given to them. So it's important when you're supporting these people that you understand the need to get permission off them. We do not just go into people and start providing care. We ask, we check they're ready, we check that care is appropriate at that time. You have to remember that service users have the right to say no to any care or treatment at any time. This includes partway through the procedure. Sometimes this will cause a conflict between your duty of care and their right to give consent. A good example of this is with medication. Service users have the right to refuse medication. Even though they might need it to maintain their health, they do have the right to say no. And we will have to look at ways of addressing that with that individual should that situation ever arise. Safety. The service user must not be given unsafe care or treatment or be put at risk of harm that could be avoided. So you as a care worker must assess the risks to the service user's health and safety during any care or treatment. You will be working with risk assessments already. You should understand how to care for that person in a safe way. But you have to understand the need to conduct a dynamic risk assessment each time you are providing care. Just because they were safe to wait bear this morning doesn't necessarily mean they are still safe to wait bear now. So you must assess them at every visit to make sure that the needs haven't changed. You must make sure you have the qualifications, competence, skills and experience to keep them safe. And that involves you taking responsibility for your training. If you feel you don't have sufficient training to support a person safely, you must report this to your manager so that that training can actually be provided. Safeguarding from abuse. So service users must not suffer any form of abuse or improper treatment while receiving care. You will have received safeguarding training as part of your induction into care. You should have a good understanding of what this actually means. It involves areas like neglect, subjecting them to any degrading treatment, any unnecessary or disproportionate restraint, and any inappropriate limits on their freedom. So we make sure that the person is receiving care in a way that does not leave them open to abuse. Food and drink. Service users must have enough to eat and drink to keep them in good health while they receive care and treatment. So it's about being person-centred with their diet as well as everything else. So giving them choices of what they like to eat. It's about good care planning, supporting that person to let you know what their likes and dislikes are. It's about finding out the individual things about that person as regards their dietary needs. So when do they like to eat? Not everybody likes to have breakfast the minute they first get out of bed. Where do they like to eat? Not everybody is comfortable eating their meals in a communal environment. So does the individual want to eat their meals in their room? This is information we should find out in the care planning process. It's important to remember that service users can, as we've said, decline food and drink, as they can decline any service that we offer them. We cannot force them to eat. But what we will need to do is make sure that you log what they are actually eating and drinking. If they are refusing food and drink, then you need to be reporting that to your seniors and to the management. If this continues over a period of time, because you will have to monitor the situation, then it might be we need to get dietitians involved, GP involved, other health professionals involved to try and support that service user to eat sufficient. Premises and equipment. So the places where you give care and treatment and the equipment you use must be clean, suitable and looked after properly. Any equipment used in service user care and treatment must also be secure and used properly. So again, the burden is on you. Your managers will have gone out and done risk assessments on the environment and on all the equipment that you need to use. And they will have adjudged that it's safe at that time. You will be using that equipment. You will be out in that environment day in, day out, providing direct care to the people you support. You are the people that are going to spot any faults quickly, and you are the people that can then report that to your manager so the correct action can be taken to mend that. Talked about dynamic risk assessments earlier. You need to do dynamic risk assessments in terms of the environment and the equipment as well. You check them every time you use them. Just because you used a hoist to transfer someone safely at breakfast time doesn't mean a fault hasn't developed since. So every time you use that equipment, you check it. And if you detect any problems, like we say, it must be reported. That equipment must not be used until it has been repaired. Service users must be able to complain about their care and treatment. This means the care provider must have a system in place so they can handle and respond to any complaints made. They must investigate it thoroughly and take action if problems are identified. So you as a care worker, you will be out there working with these guys day in, day out. You are the person that they are more likely to raise concerns to because they will have developed that trust in you. So if they do have a complaint, if they're not happy about any aspect of the care and support they're receiving, then you need to be signposting them towards the complaints procedure. If necessary, you need to help them actually fill out that paperwork. But they have the right to make their feelings heard. And you as a care worker have a role in that, in supporting them to do that safely. Good governance. As a provider of care, you must have plans that ensure you can meet standards that are in place. There must be effective governance and systems to check on the quality and safety of care. These must help the service improve and reduce any risks to health, safety and welfare. So your manager will have policies in place, procedures in place, due processes for doing things correctly. There'll be other agreed ways of working such as risk assessments and care plans. And it's important that everybody in that service is aware of their job role and they're aware of the range and the limit of their responsibilities. You as a care worker will have a certain level of responsibility in all aspects of the way that care is provided, but it is important that you stick within that. If you step outside of the scope of your job role, then there is a fair chance you will not have received training to do that. If you haven't had training to do something, it massively increases the chance of something going wrong and putting the health and safety and welfare of the service users and your colleagues perhaps at risk. So for example, if you haven't had training in how to safely administer medication, you should not be administering medication because there is a risk you will do it wrong and you will cause a problem. As the provider of care, you must have enough suitably qualified, competent and experienced staff to make sure you can meet these standards. So staffing levels are important. We must have sufficient staff on the floor at any given time to ensure the service users can receive the standard and level of care that they need. But it's important as well that these are, as it says, suitably qualified, competent and experienced. So again, it's about making sure that staff have received their induction training. They have shadowed experienced staff. They have had the time to learn about the individual service users through the care plans, so they know how to safely support everybody in those premises. It's about that training being ongoing. It's about staff being supported to complete the care certificate, to potentially move on to do the level 2, level 3 apprenticeships. So those skills can be ingrained, and we have got a good, well-motivated, well-trained staff force. Fit and proper staff. As a provider of care, you must only employ people who can provide care and treatment appropriate to their role. You must have strong recruitment procedures in place and carry out relevant checks, such as on applicants' criminal records and work history. So it's making sure that the people that come into care are safe to work in care. You will have gone through the system yourself, undertaking DBS checks, perhaps health checks, back to work interviews if you've been off work sick for a period of time, to make sure you are fit to do the job that is required of you. If not, then adjustments can be made to your role to give you a phased return into work. Duty of candour. As a provider of care, you must be open and transparent with service users about the care and treatment. Should something go wrong, you must tell them what has happened, provide support and apologise. So this is about the reporting. If something does go wrong, your manager needs to know about it, because it can affect that person's health going forward. So if you make a mistake administering medication, you must be open and honest about it. You must report that immediately to your manager, because if you don't, there could be adverse health effects to that individual. It's about reporting things to the individual, making sure the individual, their family, anyone involved in their care and treatment is aware of what has happened. It's about apologising, and it's about making sure that we learn from those mistakes and moving forward we don't repeat them. Display of ratings. The care provider must display the CQC rating in a place where it can be seen. So that means the information should be available on the company website. The latest CQC report should also be made available to anyone making inquiries for services from that service. So if somebody is ringing up to get their mother admitted to that service, they have the right to ask for a copy of the CQC report, and your manager must provide that for them. It allows people to make effective choices as to whether they think that is a suitable place for their mother or other loved one to be cared for. Hopefully this helps you to understand the fundamental standards better and how it applies to your role as a care worker.